Let me ask you something. Have you ever walked into a clinic, sat down, and within 2 minutes, somebody straps a cuff on your arms and says, your blood pressure is high, and suddenly you are worried? Maybe they mention prescription medication. Maybe you live with a new diagnosis. Here is what I want you to know. That reading might be wrong, not because the machine is broken, but because the blood pressure measurement has a surprising number of ways to go wrong. And in most busy clinics, the proper technique just does not get the attention it deserves. Today, I'm walking you through 10 of the most common mistakes produce inaccurate blood pressure readings and exactly what you can do about each one. Before we talk about treating your blood pressure, we need to make sure we are actually measuring it correctly. Let's get into it. I am Dr. Pachipala, who is board certified in internal medicine, hematology, and oncology, and I practice in the greater Houston area. The first cause, the cuff does not fit. This is the one I wish more people knew about because it's incredibly common and the effect is significant. If the cuff is too small for your arm, it has to work harder to compress the artery, and that artificially inflates the reading by anywhere from 5 to 15 points. Too large, it may read falsely low. Blood pressure cuffs comes in multiple sizes: small, standard, large, and extra large, and your right size is determined by your arm circumference, not just whether it physically fits on. The bladder inside the cuff should wrap up around at least 80% of your arm. If you're a larger person, you need a larger cuff, and you have always been measured with a standard cuff, there's a real chance some of these readings were inaccurate. Ask for the right size. It's not a big ask, it's a basic technique. Number 2 reason, arm position. This one surprises people. Where your arm is positioned during the measurement actually changes the number. If your arm is hanging down at your side, gravity increases the blood pressure in that vessel, and your reading can be 10 to 20 points higher than it really is. Arm held too high above your heart, it reads falsely low. The correct position is arm resting on a surface supported at heart level. That means roughly the level of your mid-chest, not in your lap, not dangling, supported and level. If you're sitting in a waiting room chair with no armrest and someone wraps a cuff on your dangling arm, that number is not reliable. Number 3, your posture in the chair. 3 things I see constantly that artificially raises blood pressure readings: feet not flat on the floor, legs dangling or crossed, back unsupported, perched on the edge of the table, and body tense or leaning forwards. Each of these activates a muscle group and slightly shifts your physiology in a way that raises blood pressure. Crossed legs alone can add 5 to 8 points to your systolic reading. The correct position is simple: sit upright, back fully supported, feet flat on the floor, arm at heart level, and you need to be sitting like that for at least 5 minutes before the measurement, not 5 seconds after you rushed in from the parking lot. Number 4, talking or moving during the reading. This one seems obvious, but it happens all the time. Someone is asking you questions, filling out a form, or you're just nervous and fidgeting right while the cuff is inflating. Talking during measurement can raise your systolic blood pressure by 10 to 20 points. Same with tensing the arm, shifting in the seat, or even laughing. The rule is simple. From the moment the cuff starts inflating, stay still and stay quiet. That's all. Tell the staff member you will answer their questions in 60 seconds. A good clinic will know to wait. Number 5, what you did before the appointment matters. Your blood pressure in the 30 minutes before a reading matters enormously. Exercise raises blood pressure, and it can stay elevated for up to an hour afterwards. Caffeine can raise it. Nicotine raises it significantly and can hold it elevated for 30 minutes or more. Even a stressful commute or an argument on the phone before you walked in the door can affect the number. The standard protocol is no exercise, no caffeine and nicotine for at least 30 minutes before the measurement, and sit quietly for 5 minutes before the cuff goes on. In real clinical setting, this often does not happen, which is one of the reasons a single office reading is rarely the whole story. Number 6, wrist monitors and wrong technique. The wrist blood pressure monitors are popular. They're small, convenient, and easy to use, but they are also significantly less reliable than upper arm monitors, particularly if your wrist is not positioned precisely at heart level during the measurement. The most accurate site is the brachial artery, the upper arm. That's where validated, properly calibrated monitors should be placed. The cuff should deflate at a steady rate. The patient should be prepared and still. These are not complicated steps. but they're often skipped. If your clinic or your home monitor uses a wrist cuff, it's worth knowing that the readings may not be accurate, especially if you have arterial stiffness or circulation issues. Number 7, measuring over clothing. I'll keep this one short because it is simple. Measuring blood pressure over a sleeve, even a thin one, adds compression and resistance that skews the reading upward. Always measure on a bare skin. Roll the sleeve up fully or remove it. It takes 10 seconds and it matters. Number 8, one reading is not enough and white coat hypertension is real. Blood pressure is not a fixed number. It fluctuates throughout the day with activity, stress, posture, emotion. A single measurement captures one moment, not your actual blood pressure pattern. Standard protocol is 2 or 3 readings taken 1 or 2 minutes apart and averaged. That single number from a single reading that ends up in your chart, not ideal. And then there is a white coat hypertension, which is more common than most people realize. This is when blood pressure is consistently elevated in a clinical setting but normal at home purely due to stress and anxiety of being in a medical environment or medical office. Studies suggest it affects up to 20% of the people diagnosed with hypertension. That is why home blood pressure monitoring matters so much. A blood pressure monitor used correctly at home often gives a more accurate picture of your true blood pressure than a clinic reading. Number 9, faulty, uncalibrated equipment. Monitors drift over time. The automated cuff in a busy clinic gets used dozens of times a day, get knocked around, and often is not recalibrated on any regular schedule. If you have your own home monitor, bring it with you to your next clinic appointment and compare readings side by side. If there's a meaningful difference, that's important clinical information. For home monitors, look for ones that are certified by recognized bodies such as British and Irish Hypertension Society and the American Medical Association. Both these organizations maintain lists of certified devices. Not every monitor on the shelf at the pharmacy has been properly tested for accuracy. Number 10, the environment around you matters. Cold temperature causes blood vessels to constrict, which raises blood pressure. Loud or stressful environments, even an unfamiliar setting, can keep your nervous system slightly activated. This sounds minor, but in a clinical context, it adds up. A cold exam room, a stressful wait, background noise, all of this nudge the reading, cause the blood pressure reading to go up. Where possible, measure blood pressure in a quiet, comfortable, warm environment. At home, this is easy to control. In a clinic, it's worth being aware of so you can interpret the reading with appropriate context. So in conclusion, here is the bottom line. Blood pressure measurement looks simple, but done incorrectly can be off by 10, 15, or even 20 points. And decisions about medication, diagnosis, and treatment are made based on those numbers. The right cuff size, arm at heart level, sitting properly, 5 minutes of quiet rest beforehand, 2 or 3 readings averaged, blood pressure cuff on bare skin with calibrated equipment in a calm environment. That's the standard, and it is worth insisting on because accurate numbers are the foundation of everything that comes after. If this video helped you understand what's actually going on behind that cuff, hit like and subscribe. I put out practical, evidence-based content to help you have better conversations with your doctor and make more informed choices about your health. Share this with someone who has been worrying about high blood pressure reading. It might change their perspective. Take care of yourself, and I will see you in the next video. Thank you for watching.